All right. Good morning. Good afternoon, everyone. It's so nice to be here. Thank you for having me. I'm excited today to be able to talk with you all about how to create leadership support for total worker health and small business. This is something that I've been working on for several years now. As Jen mentioned earlier, I've done some leadership work in construction, and now the work that I'm talking about today is specifically around the small business owner or other senior manager. And it stems from a 5-year study of total worker health and small enterprises that we just wrapped up at the Center for Health, Work, and Environment. I first want to acknowledge the fact that the work that I'm talking about today is supported by NYNJERC. And just let you know that, I'm from the Center for Health, Work, and Environment. We are a NYNJERC Total Worker Health Center of Excellence, and we're also an ERC. And just to mention that the work that I'm talking about stems from the work of a lot of different people at our center. And that if you're interested, you can read all about our research that I'm talking about on our website that's linked to here. So why small business? Why should we be focusing on the small business owner or other senior leader? Small businesses in the United States, there are a lot of them. I mean, a lot of businesses in America are not large businesses. And as you can see in this image here, this figure, most businesses are actually really small. Half the workforce is employed by small businesses. And so it's, I think, important for us to consider how can we help the small enterprises who typically are under-resourced in terms of staff, expertise, money, resources. How can we help those individuals in these organizations understand how to protect and promote their health? I want to start with some definitions because I'll be using these 3 terms a lot in my presentation. And so total worker health business strategies, you've already gotten an introduction of what total worker health is, so I'm not going to dive into that again. But when I'm talking about total worker health business strategies, I'm talking about the business policies, programs, and practices that are happening in an organization. It's the way that a business might manage health and safety in an organization. When I'm talking about leadership, I'm referring to what employees think about leaders in their organization. So what do employees think about their leaders allocating resources, role modeling, communicating, recognizing people, and holding people accountable for total worker health? And then finally, when I'm using the term climate, I'm talking about employee perceptions of how much their organization cares for and is committed to their health and safety. These perceptions are very powerful, and they drive motivation and engagement in total worker health initiatives. And leadership and business strategies are key drivers of that. So here's my punchline up front. I'm going to go through all of these lessons learned in a minute, but just to set the stage, in our 5-year study of small businesses, we've learned a lot about how to engage small business leaders in total worker health. And we found that there's an advantage to doing total worker health in small business, not just a disadvantage. Small businesses have different starting points when it comes to total worker health. We need to help leaders make data-driven decisions, help leaders focus on more than just the business strategy. They need to be focusing on their culture and their leadership. They need to focus on their mental health. Leaders' mental health matters. We need to help leaders build a community of like-minded leaders. And really, at the end of the day, what we learned is we need to figure out the Goldilocks model of leadership development around total worker health. So we've learned in our research that employee engagement, on the right here, behavior, this engagement is dependent on the work environment. We need to look upstream at the factors that shape and how safe and healthy employees can be on the job. And that's really, I think, the crux of the total worker health approach. It's that systems approach to understanding why what's happening in the organization is happening. And what we found in our research is that business strategies, leadership, and climate drive employee motivation. It drives their internal motivation, their identified motivation, their external motivation, and that ultimately results in engagement in total worker health programs and policies. And so if our goal is to increase employee engagement around these around total worker health, we need to look upstream at what the business is doing for business strategies and leadership. And the focus of this talk is on the leadership component here. So again, a combination of having business strategies, leadership, and climate are all important indicators of health and safety in the work environment and are associated with employee engagement. In our work, we found that we can categorize small businesses into one of 4 buckets based on data from these 3 things. So there are businesses who are beginners. They're really just starting out, figuring out their strategy, their leadership, their climate. There are businesses that are more focused on, and I should say small businesses, that are more focused on their strategy. There are ones that are more culture focused. And then there are some that are focused on both the strategy and the culture. They're more advanced. So I'm curious, what do you think is the most common approach among small businesses? And feel free to type it into the chat if you've seen it in a business that you have been in or perhaps consulted with. Please share your. Because I think you might be surprised at how common some of these are. So what we have found is, at least in the small businesses out here in Colorado, is that very few small businesses have this sort of integrated approach where they're focused on their strategy, but they're also doing the work to focus on their culture through leadership practices. We have then a split between businesses who are starting out in the beginner phase, some who are strategy focused, some who are culture focused. But the point of our research has shown that it's really important to help businesses to both. Businesses need to develop that strategy and they need to develop their leadership capacity because that results in the best employee engagement. So the question is, how do we get there? If we know, successful businesses have that strategy in place, they have leadership commitment, they have a climate that supports the business strategy on a day-to-day basis. But if leadership and climate are the factors that drive employee engagement, how in the world do we actually do that? Well, we do that through leadership development. There are lots of examples out in industry and in the academic literature of how do we develop leadership for workforce health, safety, and well-being. It's been done in a mix of industries, different kinds of training formats, different outcomes have been assessed. There's been sort of mixed findings, but really nothing has focused on how do we do this in small business and how do we do it with the small business owner or other senior leader. And that was the point of our study that we've done over the past 5 years. It was called the Small, Safe, Well study. And our goal was to change organizational behavior. We wanted to transform the way that the small business approached total worker health in their organization. And we did this by randomly assigning businesses to a condition where they were participating in Just Health Links, which is a mentoring program that's really focused on helping them with their business strategy. And also randomly assigning businesses to do Health Links plus a total worker health leadership training program, where it's that added benefit of running the small business owner or other senior leader through a leadership program to focus on their culture. So the point of our study was really, what's the benefit of helping the organization with leadership and culture? We had over 100 businesses, about 100 businesses participate in our study out here in Colorado. They were all small businesses defined as less than 500, but really most were between 11 and 50 employees. And they came from a variety of industries. About a quarter were from healthcare and social assistance, but we had industries such as education and manufacturing and construction. So a pretty diverse group of businesses engaged in this project. Our leadership development program was focused on the owner or their senior manager. Since the point of it was to really induce organizational change, we felt like we needed to focus on that senior key decision maker. And so we wanted to help them understand their current approach to total worker health and help them identify leadership actions to enhance those efforts. We used a data-driven approach, which focused on the business strategy, the employee perceptions of a healthy workplace, which is that cultural piece, but also the leader's own health. We felt like if we're doing this, we're helping the owner, focus on the health of their employees, we also need to be helping them focus on their own health, which, I'll talk about in a minute. Mental health really mattered in this situation. So our program was 4 months long. We had assessments in the program. We had a one-day in-person training where leaders of small businesses got together in person and did the training. And then we have 3 months of training transfer support. Since we're focused on organizational change, we wanted to, teach them about this, give them skills, but we also wanted to be there when they went back to their business and try to apply what we were teaching them. And so we offered coaching and an online goal setting platform to do that. So the punchline of our study is that we were very successful with our recruitment strategies, since we had around 100 employers participate, but we had a huge challenge with retention, which I'll come back to in a minute. This was a multi-year study. We were asking leaders to devote 4 months of their time to do this leadership development program, and that presented some real challenges for the small business. We found that, the leaders that did engage with us over the course of the study did report improved total worker health leadership practices, which is encouraging. But ultimately, in our randomized control trial study, we did not find changes in business strategy or employee reports of leadership, climate, and behavior or well-being. And I think that comes back to the challenges that I'm going to talk about around retention. But thinking about the positives of the study is that we learned quite a lot about how to engage small employers in total worker health, and specifically how to engage their leaders in the total worker health approach. And so that's where my lessons learned come in. So I'm going to go through each of these lessons learned and explain a little bit more about what I mean about them. So first up is the small business advantage. My colleague Lily Tenney, who's co-investigator on this project, she always talks about how we so often say that small businesses are at a disadvantage when it comes to occupational safety and health and total worker health because they're under-resourced, et cetera. But really, there's an advantage small businesses have. They're smaller, they're more agile. And in fact, in our own work, we see that senior leaders are actually more engaged in total worker health efforts than in the larger organization. So what you see on the screen here shows that when we do assessments of total worker health in small businesses, it's in the smallest of organizations, the executives are most likely completing these assessments, which shows a nice level of engagement. And when we ask why different businesses are participating in total worker health or engaging in efforts to think about their strategy for total worker health, executives are saying they're doing it because of morale reasons, whereas HR professionals who are typically doing, in charge of this for larger organizations, are doing it for cost reasons. So it's sort of interesting to think about the small business advantage here, especially when we're thinking about engaging leadership in total worker health. Second, small businesses have different starting points when it comes to total worker health. We can't assume that every small business is going to come in as a blank slate. Oftentimes small businesses come in with something around safety, mandate, whatever's mandated by OSHA maybe, or maybe a little bit more. But there's also several small businesses out there who are already focused on health promotion. There's a lot of small businesses that, even if they can't afford to offer health insurance, they're doing something around worksite wellness, whether it's lunch and learns or EAPs or things like that. And then there's some who are doing more. So I think it's important to recognize that there is no one size fits all approach when you're starting to help the small business think about what they're doing. But what we've learned, or specifically around leadership, is that small businesses recognize that leadership is important. They need leadership support in order to make change around total worker health, but really it's not always understood or practiced. So we find that, when we ask small businesses, are your senior leaders champions for health in your workplace? Only about half of them say yes. We did an interview study with some small businesses here in Colorado, and we asked, when we were asking them about total worker health leadership concepts, They could understand it from the business strategy perspective, those policies and programs, they could have a conversation about that. But when we asked them about the cultural aspects, about their employees, their most common response was that employees are viewed as a barrier to program success. And I think that's just a function of not really understanding that motivational piece. A lot of employers will say, let's try this total worker health, let's start providing these initiatives, without laying the groundwork of a needs assessment or engaging employees in the process, like what Jen was actually talking about in her talk earlier about, really involving them in the process of total worker health. And they generally understand the value of leading by example as a key leadership skill, but they don't really understand communication strategies or ways to motivate employees. When leaders are coming into a leadership development program around total worker health, we find that they're coming in with different readiness to change. So some folks are more ready. They've thought about wanting to apply the total worker health approach. They're actively thinking about ways to do it. But some are really coming in, just at an early stage, thinking that, okay, maybe this could be interesting, but haven't really thought about it. And so when designing leadership development programs, I think it's important to recognize that, again, that one size fits all approach isn't necessarily going to work. However, what we found in our study was that even though leaders from small businesses are coming in at different stages of readiness, different quantities of total worker health policies and programs, all of them are generally reporting an increase in their leadership practices after our program, which is encouraging. So the leaders who were in this program reported that they were providing a more supportive work environment for their employees. They were role modeling. They were, encouraging growth and change by taking risks and trying new things around total worker health. And they were expecting and recognizing success by, providing feedback to folks around what they're doing around total worker health in their organization. The third lesson learned here is related to our strategy for how we taught about total worker health leadership. So when we taught about total worker health leadership, we were teaching them about their business strategy, we were teaching them about their culture, and then we were teaching them about their own health and well-being. We thought that these three core areas were really important for leadership development around total worker health, because some of our groundwork that we did before this, like I said, really found that leaders were really honing in on that business strategy piece. It was easy for them to think about policies and programs that they could develop, but it was hard for them to think about culture in their organization and really what employees thought about health and safety in their organization. And that brings me to my fourth point here around data-driven decisions. So leaders really found value in evaluating their approach to health and safety and well-being. They, during our program, we gave them data specifically about their organization around their business strategy, their culture from employee health and safety culture surveys, and data around their own health and well-being. They felt that it gave them a really good, complete picture of the work environment. And actually, a lot of small employers really appreciated all this data because they didn't necessarily have access to this data or know how to collect this data. And this really helps them make decisions about what they wanted to do next as they were working to apply the content from the leadership training. And what they were choosing as goals after looking at this data was sort of interesting. The leaders in the small business were focused on foundational things around applying the total worker health approach and not necessarily focused on implementing specific policies or programs. So they recognized that they needed to take a step back. They needed to write a plan for their program, start from the ground up, really consider the needs and interests of their employees when writing that plan. And they needed to take time to enhance their health and their safety and their well-being so that they could be good role models in the process. Our fifth lesson learned is related to leaders' own health. So really interestingly, we found that after the program, our leaders actually reported an increase in work-related stress, which isn't something that we anticipated, but I think unfortunately makes sense given the potential high cost of quality leadership, which could come from, we were giving them more responsibility, We were adding complexity for the way that they were handling health in the workplace. Some of them may have felt their goals may have been too difficult. There may have been some emotional labor in the process. And I think this really highlights that if we can't take care of leaders' mental health, we won't be able to help them effectively help their organization. So I think, in leadership development programs for the small business leader, we have to help leaders with their own health as well along the way. Our sixth lesson learned is that in our leadership program, we were focused on that senior leader, but we also invited them to bring someone who handles health and safety in their organization. So maybe that was their safety representative or their HR manager, but they brought someone from their organization to the leadership development program. And that really helps them facilitate a shared vision for total worker health in their organization. And they really liked that community as a source of support for each other. Our seventh and final lesson learned, and my current challenge, is finding that Goldilocks model of small business total worker health leadership development. I think what we've seen from our research and what others have seen in other studies and other populations is that training itself can change attitudes and self-reported behaviors for leaders. I think we've seen that pretty consistently with some leadership intervention research. But the challenge remains in how do we help the small business leader transfer that training to their workplace so that we can observe change in business strategies and culture. And so I think the real highlight from our research is that, we need to figure out, the right dose of leadership training for small business leaders. Our training was 4 months. It had in-person components, some virtual components, some assessments, so it was pretty involved. There's other models of leadership development out there that are just focused on maybe online trainings or half-day trainings, maybe just coaching, maybe meetings or mentoring. There's different models out there, but what's the best way to help the small business leader? Because one of the main barriers we heard from our small businesses is time. Time is a valuable resource that they struggle with. So how can we integrate this kind of leadership development process for them in the context of what they already do, so it doesn't seem like such a burden? So again, our lessons learned was that I think we can frame some of the stuff around total worker health and small business as an advantage, not just a disadvantage. Recognize that small businesses have different starting points. Leaders are starting at different levels of their readiness to engage in total worker health. They value a data-driven approach to help them make decisions. The small business leader needs help focusing on more than just their business strategy. They need to focus on leadership and culture. In the process, they need help promoting their mental health. And I think some ways in moving forward, we need to think about community for leaders to help them receive support. And ultimately, we need to figure out the Goldilocks model of how to do this. The things, I'll just wrap up by saying the things that I'm thinking about in this space in the future is a shared or distributed leadership approach where, yes, we have small business owners involved in leadership development around this, but who else in their organization and really who else in the community can help them with their goals so that they don't feel like they're going at this alone? Who can be on their team? And part of this is a community of practice, which I'm hoping to do this out here in Colorado, up in the mountain communities, because leaders from different small businesses love interacting with each other and learning from each other. And I hope that that sort of model can provide support as well. And I also think our leadership development program was not focused on specific health hazards. It was very general about total worker health in general. But I think there's value in honing in on specific health hazards and health conditions such as mental health for both the leader and their workers in a sort of targeted approach. I also have some slides in here just to mention, I think we probably have some students on in this conference, just to mention that we have a certificate in total worker health program if you're interested in learning more about the approach. It's part of our ERC, so it's funded and we have scholarships. Our next deadline is on the 15th, which is in 4 days, but we also have a deadline in the fall. I'm happy to answer any questions about that. And we also have a pilot project program, $25,000 a year of funding for projects that are both research focused and research practice focused. And we have a lot of priorities for funding around this project, as you can see. So if you have any interest in either education or research pilot projects, we have some resources, and I'm happy to talk more about that as well. Thank you so much for your time, and I'm definitely happy to answer any questions in the chat or live.